Welcome back, or welcome to, if it's your first time visiting us. We are in this together, the television show by the International Federation of Red Cross and Red Crescent Societies here in the Americas. I'm Angela Hill. I'm the host of this show, which basically just means I am here to interview very smart people about the areas they work on. And fortunately, joining me today is my colleague, also from the Red Cross, Elena Pedrazzani. And Elena, where are you based out of?
I am based in Lima, in Peru.
So she's all the way from Peru. I'm in Trinidad and Tobago, and we're talking to everyone in the Caribbean and throughout English-speaking Americas. And today we're going to talk about masks. We know a number of countries have had governments ask people to get masks. They usually clarify to leave the very technical, they call them N95 masks for healthcare workers, but they're talking about having other kinds of masks. And so today we wanted to take you through a little bit around how to stay safe when it comes to wearing a mask, and how to take care of a mask if you have a cloth mask. So Elena, maybe can you walk us through a little bit of the how to wear a mask and how to stay safe while wearing a mask?
Yes. Thank you so much, Angela, for hosting me on this show. It's the first time, so let's see how it goes. Even though I talk about masks pretty much the entire day, it's the first time that I'm talking with someone about it in such detail, right? So yeah, so first of all, just a little bit on masks. Yeah, the most important things about mask is how you wear it, and then we can also look a little bit at the different type of masks. But basically, masks, and I have here my little mask that I'm using to go out grocery and everything, are very simple. The most important thing is that first you need to always wash your hands, because we don't know really what we have touched. I mean, we all have handles and stuff that we don't really know, like coming into the building, for example, I have to touch 5 different doorknobs. So if I wear my mask or remove my mask, I don't really know what stuff goes there. So the first thing is wash your hands 20 seconds with soap or alcohol-based rub. And then you must take the mask like by its, how do you call it, rubber bands?
Like ear holders?
Yeah, ear holders. I never know how to call them. So, and applying it, and that's it. And once you need to make sure that it covers your nose and your chin. Everything needs to be covered. And now to take it off, it's exactly the same thing. But most importantly, first of all, let's wash our hands. Again, we take it out, we put it in the garbage, in a special garbage, and then we wash our hands again. So lots of hand washing. Always make sure that you don't touch this part or this part. So yeah.
You know, something you said I think is really good, that you put it on carefully and just touch the pieces here, and then when you start, you touch the top to make sure it's high enough, and the bottom. We don't really want to touch these things during the day, right? Like we need to make sure it fits when we put it on.
Yeah, that's a very important thing. Like once your mask is on and once you're out and about, try not to touch the mask and try not to touch the other part of your face anyway. And that kind of links with what you said before, like masks is not just is not a universal cure about how we protect. It's one measure among a lot of measures that we need to take as a whole to be protected. And so hand washing, always be mindful of not touching your face, whether you have masks or you don't have masks, because maybe in your country you don't have to wear a mask. And we can talk a little bit about that, I think, later, because there's a lot of questions that I know people might have about the use of masks. But I mean, masks are very effective. We know that they are an important part of how we are preventing the spread of COVID-19, but they're not the only thing. So measures such as practicing social distancing, making sure that we don't cough in our hands, but we use either our elbow or we use a little tissue and we dispose of it immediately after we've used it, as well as not touching our face, are the measures that we need to keep using and doing to make sure that we limit the risk of infection.
And I know it can be tricky. I mean, I see this all the time, and I even have to catch myself. I often feel it sliding, so I'm perpetually trying to push mine back up again. So, I mean, people have to be really cognizant of it. You've got to think about not doing it. The other one to think of is when we all wear masks, we're covering our mouth, and often we use looking at someone else's mouth to hear them. And so the number of people I see lean forward so they can catch what someone says and then pull down their mask so they can talk better. I mean, we really need to avoid steps like this because, again, you're touching your face, you're touching the outside. And as Elena said, it's really part of a bigger picture. And it's about preventing the spread, right? It's about keeping my germs in me and your germs with you, but it doesn't necessarily stop your germs from coming to me. We can't just assume that because we're wearing a mask, now we can be really safe and close. Elena said it perfectly, which is we still need to keep that physical distancing in place.
And it's a journey, and even for, it's a journey for everyone. I remember the first time I used a mask was probably a month ago, and I briefly left my house to go to the office and take a couple of paperwork that I needed, and I forgot there. And I was not used to the mask, and I was even doing like, oh, should I wear it here? Should I wear it below my nose? So I think it's very much of something that we need to learn. It's like at the beginning when we had smartphones and we didn't really know how to use them. It's something that eventually, and especially for the next months, will probably become part of our everyday. It's something that we need to learn how to use safely, because otherwise, unfortunately, they're not useful. It's not just putting something on our mouth that can help prevent the spreading of the disease. Also, because even in mask territory, there is so many differences that we have. And so that's why I like the comparison to a smartphone, because as we know, like that a smartphone has a lot of memory or a better cam. Well, masks have a better screen protection from droplets. That's why some people prefer cloth masks. Should they prefer a cloth mask? So there's a lot of things that we can talk about masks.
And actually, speaking of cloth masks, let's talk about that. When we come home, we take it off. It's not just a matter of hanging it up and taking it out again. There's steps that need to be taken to make sure they're clean. Can you walk us through some of those?
Yes. So the main difference with cloth masks in terms of care is that cloth masks can be reused many times. The important thing is what we do between those uses. So while the instructions to put it on and off again are the same, so we still need to make sure that we don't touch the main part of the masks and only the rubber bands to put it behind our ears. It is very important that when we come home from our grocery shopping or from our pharmacy visit, we wash immediately the mask with hot water and soap. And we also take extra care in drying it, because the problem with cloth masks is that in dampness, a lot of bacteria and other nasty stuff, let's say, can thrive. So it's very important that once the mask, either every time that you go out or as soon as a mask becomes a little bit damp, it's washed and it's washed properly. So hot water, normally above 60 degrees, soap, and dried either in the sun or in a tumble dryer. So avoid as much as you can to keep masks in a damp state. And normally we consider or we recommend to have 3 masks per person at available in the house. This is because, especially for those people that need to wear a mask for a longer time each day, they need to change it throughout. As soon as the mask gets damp, it's full of nasty stuff. So then it's when it loses its purpose.
Wow. So there are lots of things to think about. It's not quite simple. And you also mentioned that if you have a disposable mask, you should dispose of it carefully or in a special place. Can you just sort of speak to that?
Yeah, so with disposable mask, it's very important that once the mask is has been used, so once again you come home, what do you do with your mask? You can either put it in a little protective bag. It can be a plastic bag, well, hopefully not a plastic bag, but let's say like an eco-friendly material bag that you then throw away in your garbage, but it has to be sealed. Or you have a special garbage, like a little container that you dispose of separately. It's always important that the masks are isolated from other garbage.
All right. That's really good advice. I think that's pretty much all the time we have. And it's a really good descriptor of, you said it right, the things that we have to get used to in order to keep everybody safe and healthy. I don't know if you have any last words before we wrap up.
Well, just make sure that you wear your mask where you have to. And it's a little bit about social distancing. I think that, as you said, many people think, oh, I have a mask that will protect me. And just be mindful. And also because I have caught myself doing it, that you don't lean in when talking to other people. Still try to keep that meter and a half distance with other people, because it's a combination. So as you said, masks are just part of a larger picture. So keep washing your hands, keep practicing social distance, and keep hopeful. Like, we really need to be keeping hopeful in this time. And yeah, I think that's it. Thanks so much.
That's great. Thank you so much for joining us, Elena. As she said, let's keep working together. We are in this together. That's why we called the program that. And these are the steps we can take to protect ourselves, but not just ourselves, right? We're protecting our families, our friends, our communities, our loved ones by taking these steps that if we have to go out, we're going to keep our germs to ourselves. But the rest of the time, we're going to stay in. We're going to keep that physical distancing in place. If you have any questions at the end of this, put them in the comments below. We're going to check the comment section and work to either answer the questions right in the comment section or on future episodes. So keep watching, keep giving us your feedback. Thank you so much. We are in this together. That was Elena. I'm Angela, and we'll see you next week. Thank
Thank
you.
you.